Hello and welcome to the Centre for Ageing Better's webinar, exploring the key themes of our flagship report that we've just published, The State of Ageing in 2020. For those of you who don't know me, I'm Anna Dixon. I'm the Chief Executive at the Centre for Ageing Better. And I'm really delighted to be joined today for this event by a number of fantastic guest speakers who are going to be responding to the findings of our State of Ageing in 2020 report. They are Dr. Janelle De Grucci, who's President of the Association of Directors of Public Health, Councillor Rebecca Charlwood from Leeds City Council, and Jack Jones from the TUC, and I'll introduce them to you as we go through. I'm also joined by colleagues from Ageing Better who have been the main authors of the report, and I'd just like to really thank them for the amazing work that they have done, and that is Catherine Foote, our Director of Evidence, who job shares, Emily Andrews, our Senior Evidence Manager, together with Aideen Young and Amy McSweeney, and they've done a fantastic job. And if you haven't already had chance, really encourage you to go to our website and explore the full report. But for today, we're going to be interacting with you on Slido. So hopefully those of you who registered for the event have had information about this and may already be logged in. If not, there should be information about this in the chat and on the YouTube comments. So please do go to Slido. And the event hashtag is #AgingBetter with a capital A and a capital B. And we're going to be using that to interact with you, to get your questions and to do a couple of polls. So really encourage you to get on Slido now. And there's already a poll open, and we'd love to hear from you where you're watching and joining us from today. If you are watching on demand, you can join the conversation on Twitter and using the hashtag StateOfAging2020. So please do interact with us and post your questions to us. But if you're on Slido, please do tell us where you're watching from now. So we've got a few people actually joining us from Ireland. Welcome to you. From Newcastle upon Tyne, Sheffield, Rotherham, Glasgow, Taunton in Somerset, Oxford, London. So please do find your way onto Slido and tell us where you're coming from. And we're going to be having another sort of polling question shortly, but I think we'll do that after making some introductory remarks. Some of you will know as well that our vision at the Centre for Ageing Better is to create a society where everyone enjoys later life. And that means addressing the inequalities in how we age. Back in 2018, we identified 4 priority areas where change needs to happen if we're going to make a reality of that vision. And we're focused particularly on how we tackle things as people are approaching later life. And we want to see that people are approaching later life in fulfilling work, living in a safe and accessible home, having the support and opportunities to stay healthy for as long as possible, and to live in communities which enable people to connect with one another. We obviously are living at the moment in a time of great challenge and uncertainty, and the pandemic has made clear just how important all these things are to improve our resilience, both as individuals and as a society. The report, The State of Ageing, it really puts this in numbers. We use data from a variety of sources, setting out a clear assessment of how people in England and in the UK are ageing today. We look at past trends to see how we got here, and we take a look to the future. And it's very clear that if we don't take action today, we may be on a path towards a more negative future for people in later life. Now, obviously, these numbers are only part of the picture, but I do think they start to show us key areas where change is needed. So great to see more of you joining us on Slido. I see we've got people joining now from Barcelona, so we've gone international. That's fantastic. From the south of France. We've got people in Liverpool, in Wiltshire. I see somebody's popped on there from Austria. So great to see so many of you joining us, not only from around the UK, but also from further afield. So you are all very welcome. And we'd like to now go to a polling question just to get a sense of your views before we start. So the question is, the gap between those who age well and those who struggle, will 1 get bigger, 2 get smaller, or 3 stay the same? So if you could vote now on Slido, we'll get to see whether you are pessimistic, optimistic, or neutral about the future. So the gap between those who age well and those who struggle will get bigger, get smaller, or stay the same. So please vote now. So there's quite a lot of you not voted yet, so do please have a go at the poll. Hopefully people have found it. We'll give you a few more minutes to get your responses in. I'm wondering actually if we might just leave the poll open, because I can see that people are still voting, and maybe you'd like to carry on voting if that's possible, while we hear from Catherine, who's going to outline for us some of the key findings, particularly around health inequalities and housing. So I'd like to introduce Director of Evidence from Ageing Better, Catherine Foote.
Thanks very much, Anna. So, morning everybody. I'm just going to introduce some of the data from our report this morning, some overview data about how we're ageing the population, and then a focus on health and housing from me first. And as Anna said, taking action on how we're ageing is so critically important in the moment of the UK, because we are, of course, experiencing this massive age shift. So here's the population in the year 2000, when 1 in 6 of us was aged 65 or over. Right now, it's just under 1 in every 5. As you can see, that triangle population pyramid starting to turn into a rectangle. And in less than 30 years, when all of Gen X will be over 65, it's going to reach 1 in 4 of us. And who's in those older age bars? Who it is that's getting older, and what sorts of families is changing too. So the proportion of older people who are Black, Asian, and from other non-white ethnicities, that's going to be increasing. And family structures are changing too. More people are entering later life single, divorced, or living alone, as this chart shows, and more people are aging without children. So this age shift has absolutely profound implications for how we all live our lives and how we organise our public policy and our institutions. Fundamentally, the fact that so many of us are living longer should be a fantastic achievement. It's a huge success story, isn't it, of massive social progress. And it's thanks to advances in public health and nutrition, medical science and vaccination, of course. And later life can be a time of good health, activity and enjoyment. But what I think our State of Ageing 2020 report makes very clear is that there are huge disparities in how we age. So if we take wealth inequalities, for example, they widen enormously as we get older. The least wealthy people aged 65 have 12 times more wealth on average than the least wealthy aged 25 to 34. But they have 37 times less wealth than the wealthiest in their own age group. And on the current trajectory, these sorts of inequalities in our experience of aging are set, I think, to deepen further for future generations. I would definitely vote in that top bar of the Slido poll. And that's not just in terms of wealth, but in terms of health and housing too. So taking health, of course, the state of our health as a nation has been brought into extremely sharp focus this year by the pandemic. But even before COVID, progress on improving life expectancy was starting to stall, and disability-free life expectancy, those turquoise lines, had actually started to fall, so that the average baby girl born in 2018, she can expect to live to just 62 without a disability or health condition now, and that's down from almost 65 in only 2010. In the poorest parts of the country, a baby girl has a disability-free life expectancy of only 51. And that means she's currently set to spend 16 fewer years in good health than a girl born at the same time in the wealthiest parts of the country. And this is a pattern that plays out across all common physical and mental health conditions. So here are rates of depression, arthritis, respiratory illness, and diabetes among the poorest women. And here, in the light blue at the other end, are the rates among the wealthiest. So the poorest women aged 50 and over, for example, are 4 times more likely to suffer from depression than the wealthiest. And these worsening trends and widening inequalities show up also, of course, in a clear north-south divide in health. So there's a large geographic variation in the proportion here shown of people with 3 or more long-term health conditions. And that proportion, incidentally, has increased over time in almost every region. Physical activity is, I think, one of the most important ways we can take action to keep healthy. But the older you are, the less likely you are to be keeping active. So 1 in 4 people in late middle age, the age 55 to 64, are classed as inactive, meaning that they do less than 30 minutes of physical activity a week. Now, there's geographic variation here too. The most active people in middle age are in Cumbria and North Yorkshire, the least active down south in Luton. Lots of us clapped for the NHS, didn't we, from our doorsteps and windows this spring, but supporting action on this data and what lies behind it, supporting action on health inequalities, mostly means action outside the NHS, in our streets, our local facilities, our communities, our workplaces, and of course in our wider public health and social security systems. And now more than ever, I think we have to take a focus on prevention and support for those with health conditions in the poorest communities seriously. Housing is another really important part of the picture. So let's turn now briefly to some of the data on housing. Of course, during this pandemic this year, many of us are spending more time in our homes than ever before, but far too many of these homes are not the places of safety and comfort that we need them to be. There are 4.3 million homes in England that do not meet basic standards set by the government. They're cold, they're damp, or they contain dangers that can cause injuries and falls, and at least half of them are headed by someone aged 55 or older. And a million of them, incidentally, have at least 1 child living there. Of course, the solutions to addressing poor housing are going to be different for people living in different tenures, and it's the private rented sector shown here that has the highest proportion of non-decent homes, and more of us are renting privately as we age, with implications, of course, for our finances, as well as for our capacity to tackle those problems in our homes. How satisfied we are with our housing varies according to how well off we feel financially. We asked people in their 50s and 60s this year how they felt about their homes during lockdown. And the more financial difficulties they were facing, the more they were likely to say that their home needed repairs or improvements. The quality of our home varies in other ways too. It varies by ethnicity. So, for instance, people in Black, Asian and minority ethnic groups have on average 30% less floor space per household member than white people. And of course, overcrowding has been cited, hasn't it, as a factor for the higher incidence and mortality from COVID among these BAME groups. So we need a major programme of action and investment to support people on low incomes across all tenures to improve their housing condition. But this year has led many of us to reflect that much more, I think, on our homes and where we want to live. And for people approaching later life, you can see here from this chart that it's Londoners who are most likely to say that this year has made them want to move. And what people want
Okay, I think we
I'm
just
just trying to move the slides on. Rose, can you give me a hand?
Yeah, we've just lost you for a moment there, Catherine, if you want to come back on.
So I'm here. I wonder if anybody can hear me. Apologies, everyone. I think I had some trouble with my connection there. What I was trying to say was simply this chart here, talking about what people want from a new home and how it is exactly what you would expect. The top two responses there from people over 50 being safety and outdoor space. But as we age, though, more of us are going to experience changes in our mobility that will mean that we need places to live that are adaptable, with things like grab rails and walk-in showers, and accessible with level entrances and downstairs bathrooms. But our housing stock doesn't remotely yet reflect those needs of an aging population. So only 9% of our current stock meets these most basic standards of accessibility. Ensuring that we have housing stock that's suitable for everyone as they age, I think, has to be a central issue for housing policy now and in the future. We need to be building homes that our ageing population needs now and will need more in the future. So, in my view, mandating accessible housing stock into building regulations is a really important first step in creating the housing stock that we're going to need to respond to these age shifts in our health and population that I've outlined for now. Thank you.
Thank you so much, Catherine, for giving us that really great overview of the data and the key messages around health and housing. So I'm delighted now to be able to introduce to you Janelle DeGrucci, who is the president of the Association of Directors of Public Health, who I think has had a chance to have a look at some of the data, particularly around health and health inequalities. So I'm going to hand over to Janelle to respond.
Thanks very much, Anna, and thanks for inviting me to say a few words. Firstly, I must say I was really impressed by the way that you've approached this and the report, the web format and the graphs and the narrative and then the action points. So I'm going to be commending it to all our directors of public health to use. So the information and the advocacy actions were great. So I just wanted to make 3 quick points, if I may, and I think in some ways it's reiterating the points you've drawn out from in the report. You know, at the start of COVID, I'm going to obviously reference COVID. We heard at the start, you know, the regular refrain that COVID was an equalizer because we could all catch it and we're all in it together. But the harsh reality is that some of us are more in it than others. You know, as actually with previous pandemics, the virus or any infection, it's both driven by and disproportionately impacts among the most vulnerable in our communities. The older people, those from BAME communities, those in overcrowded or poor housing. And as you quite rightly said, often these intersect and they drive the inequalities even deeper. And I think what we're seeing, both I think in the first wave and now in the second wave of COVID, is that well, certainly after the first wave, the infection, particularly in the northwest, became endemic in particular communities, and often that related to large multi-generational families in poor housing. And so that was definitely kind of a structural issue. And so older people were definitely within that environment. So I think it became endemic in those communities. With the second wave, you can see a real spike on top of that, and the whole country goes into lockdown. But the real concern is that those inequalities, those structural inequalities in those communities, will remain and will continue. And often the communities that have been in restrictions for a very long time. So I think we need to think quite carefully and coherently about how we're going to mitigate the inequalities. And that's both in the short term from COVID, but crucially it's tackling the causes of ill health over that long term. For us, a life course approach is clearly tells us that healthy aging and tackling inequality starts at birth, and it continues through the lifetime. So for us, as directors of public health, or with a public health approach, prevention and creating the conditions for healthy living needs to be there throughout our lives. From where we live, where we grow up, where we work, how we age. All of that is really important in terms of healthy aging. And I think for us, councils, working in councils, clearly at the forefront of both addressing the short-term inequalities, but also it needs that long-term effort to create conditions for our local communities. And I think for us, a key aim of the transfer of public health into local government was to think and act holistically when it comes to addressing all those social determinants of health. And we need to make sure that we continue to do that. I think, both COVID has really highlighted those inequalities, but there was work underway pre-COVID. If we remember, the Marmot Review 10 years on was published in February, we really do need to look at those areas, the 5 areas that were highlighted in terms of reducing inequality. A number of local authorities are working in depth to develop the Marmot approach to reducing inequality, and I think we need to really intensify that work. But I do think the second point I wanted to make was just the funding related to this. Unfortunately, public health, it's been underfunded, it's been undervalued for a long time. The cuts since 2014-15, we've had 850 million pounds of cuts, and it's left us in a weaker position. And I just think we need to be honest about that. And the new spending review and budget, it effectively is reducing public health locally again, and that's not a good place for us at all in terms of our efforts. But I'm really proud of what local government and partners locally have achieved in terms of tackling COVID, despite the massive cuts. And I just think really, though, there absolutely needs to be advocacy and action around increasing the budgets to local government and particularly to public health, because I do think the work that we have been trying to do in terms of tackling inequalities and healthy aging or healthy life course is definitely being jeopardised.
Thanks very much, Janelle. We've got a few minutes for questions. So can I just ask Janelle perhaps to mute? I'm getting a little feedback on your mic. Encourage listeners to go over to Slido. We've already got some great questions coming in, and you can add your own questions, or you can put a thumbs up next to other people's questions, and those that get the most votes get to the top. So we'll try and pick up some of the sort of questions that you have in our discussion, and we'll have chance for a wider discussion of the all the findings at the end. But let me just pick up 1 or 2 questions that have come in specifically around inequalities, which obviously Catherine highlighted in the findings, and you picked up on there, Janelle. So there is a sense that the inequalities are widening and that potentially the pandemic and the impact of COVID is going to make that worse. You talked a little bit there about the key role of local government, but do you have views on what national government could and should be doing, and what action is going to make the most difference in the sort of short term and then in the longer term? We know that obviously you mentioned there it's a life course, so particularly thinking about how do we intervene for people perhaps in their 50s and 60s now to mean that they're not going to have a long-term legacy of ill health that they take into their later life. So Janelle, do you want to go first and then I'll come to...
Thanks, Anna. There was a lot in there. So I think I did look at the actions that you have as a result of the work that you've done, and I fully endorse that. I think those things are really important. I think at the moment, the immediate necessity is money. And I don't just mean for local government or public health, I mean for people. People are really, really struggling with just having access to resources and money really to get by. So I think that really is critical. So I think the work, so whether that's in terms of welfare, it is also there in terms of jobs, and you've highlighted that, and how the redundancies that we see and how does that impact in terms of older people. So I think those kinds of really immediate addressing some of the immediate experience of people is really, really important. Money, food, jobs, those basics, housing are all really, really important, I think.
Thanks very much, Janelle. Catherine.
I'd echo that absolutely. I think to pick up on the mention of housing, I might just expand on that to say that I think, at the moment, still so much of the debate about the so-called sort of housing crisis in this country is about the need to build more homes. But actually, we've had millions of people living in existing housing that's actively dangerous and damaging and putting them at greater risk of COVID, in fact. People with certain sorts of long-term conditions. And so I would just echo all of those things about the fundamentals of people's lives. And for me, the homes they're in is part of that. And so action on the condition of some of our worst existing housing stock, I think, is crucial.
Thanks very much. There's a couple of questions coming through on the Slido about sort of midlife and whether there's a need for a more targeted and perhaps holistic life check or health check at 50. And so just what interventions, could we build on the NHS health check, for example, to encourage more healthy behaviours and to sort of make a difference to how people are, what health actions they're taking at that age? I don't know if you have a view on that.
So I think health check is it's possibly one of the things. I think I would rather look at how we enable and empower people just to live healthier lives in everything that they do. And that's about the places that people live in. It is about things like we've said about housing, the communities that they live in and so on. All of those things are really important. I'm not sure that that's necessarily where our focus needs to be. It feels quite servicey, quite sort of one-off kind of check type thing. I think there's probably other things that we need to be doing to ensure healthy aging.
Thanks very much, Janelle. And thanks so much for responding to our report and for committing to promote the findings across all of the directors of public health. And I know that they're all doing a fantastic and really difficult job at the moment. So we're really grateful for everything they're doing, and we look forward to continuing to work with ADPH and your members to tackle some of the issues highlighted in our report. I'm going to ask now to see the results of our poll, and we're going to just do that before we move on to the sort of second theme of state of ageing, which is looking at work and the economy. So let's see how optimistic or pessimistic. I'm afraid it seems that a lot of you are pretty pessimistic. 86% thinking that the gap between those who age well and those who struggle will get bigger. 8% on the more optimistic side, and just 6% on the sort of neutral, that things are not going to get better or worse. So we've heard about health inequalities. So I'm now pleased to introduce my colleague Emily Andrews, Senior Evidence Manager at the Centre for Ageing Better, who's going to present the findings on state of ageing around work and economy. So over to you, Emily.
Thank you very much, Anna. Great. So yes, I'm afraid I don't know if I'm going to cheer anyone up, at least not initially, but perhaps at the end. So as we entered this pandemic, 1 in 3 workers in the UK, that's 9.3 million people, was aged 50 or older. And that's not just because of the age shift that Catherine was talking about. Yes, there are more people in this age group, but also a growing proportion of them are in work. So since the year 2000, we've seen the employment rate of people aged 50 to 64, that's the group in the middle, grow from 60% to more than 70%. So while we can still see a big age gap with the immediately younger age group, it has shrunk enormously. Sorry, a big employment rate gap. But ageism in the labour market, interacting insidiously with sexism, racism, disableism and socioeconomic disadvantage, has not disappeared. Prior to the pandemic, there were nearly 800,000 people aged 50 to 64 alone who were not in work but wanted to be. And this year, of course, the state pension age has reached 66. So there is 66 right there, with ages 50 to 75 along the bottom. So this year, 66 is the state pension age, but in March, just 1 in 3 women were in work at age 65, and as were 42% of men. And now, as we face the possibility of job losses to rival the early 80s, the progress that has been made is in jeopardy. Now, we're not really seeing that feed through to the high-level employment statistics yet, at least not in the scale that we're expecting. But what we do know is that at the initial height of the coronavirus job retention scheme, 2.7 million over 50s were furloughed. Furlough rates formed a U-shape, with the youngest and oldest hardest hit. So there's the U-shape, and here's the chart with just the 16 to 25s, and then 55 plus, which is when it starts to creep up. In September, the Resolution Foundation found that furloughed workers in the oldest age group that they looked at, which was 55 to 64, were the least likely to have fully returned to work. And since March, the number of people aged 50 plus claiming unemployment-related benefit has doubled. So the initial impact of job losses from this recession on 50 plus workers, and looking at this particularly on 60 plus workers, will be severe in some places. But what we're most worried about is what happens next. When we lose our job at this age, we know that we tend to struggle the most to return to work. So for example, in 2019, out of everyone aged 16 or older who was made redundant, around 50% returned to work within 3 months. But if we break that down by age, we can see that it's much lower, just over a third, among the 50 plus. And similarly, prior to the pandemic, nearly 30% of people who are unemployed at this age have been out of work for a year or more. Again, that's more than other age groups. And as the supply of available labour grows, there's a risk that this situation will get worse. So this week, the government announced its £2.9 billion restart scheme. But after some promising noises in the early reports, there was nothing explicit in the spending review statement about older workers. Now, the proof will be in the pudding, and there's many details to come. What we need to see is targeted, individualised employment support for this group that kicks in before people become long-term unemployed and includes opportunities for those with long careers in shutdown sectors to retrain. Now, financial security is, of course, the key reason why equitable access to fulfilling work in our 50s and 60s is so important. But we also care about the social connection that work can bring. Having meaningful connections and relationships to other people is vital to our well-being as we age, as we all know, and community connections form the focus of the final section of our report. And here, perhaps I can cheer you up, there's much to be positive about. The crisis stimulated an upswell of community activity and mutual aid, building, of course, on what was already there in our communities. And in a general sense, people in mid and later life were well placed to benefit from this, as participants in and as receivers of support. So older people in general are more likely to express a sense of belonging to their neighbourhood, and we can see that increasing up the age bands. Volunteering follows a similar pattern, as does the phenomenon of chatting to one's neighbours. And this latter issue is perhaps unsurprisingly geographically differentiated. It's just a map that I enjoy. So 50 to 70-year-olds in North East and South West England are more likely to chat regularly to their neighbours than people in other parts of the country, particularly where I am in London. Now, a large proportion of people in their 50s and 60s say that they've become closer to their communities during lockdown, whether that's no more people they could count on, no more local voluntary groups, no more people to say hello to, or feeling an increasing sense of belonging. But the research that we undertook over the summer indicates some inequalities underneath these headlines. These increases are far greater amongst those who felt that they were living comfortably than among those who didn't. And that could suggest that those who might have needed this help the most were the furthest from it. Now, digital connectivity has, of course, become more important than ever in 2020. Hello. And it is a damaging and ridiculous myth that everyone over 60 is an IT novice. That's just absolutely not true. But the fact remains that the vast majority of the 4 million people in the UK who have never used the internet are over 55. And that's in spite of rapid increases over the last decade, particularly among the 65 plus. Look at that incline. That's 7 years of growth. The data does point to a way forward. The most frequent reason given by people in this age group for not using the internet isn't lack of trust, isn't a lack of equipment, but a lack of skill. So there's a willing and ready audience here for digital training if the right arrangements are put in place. Now, these networks of community connections are underpinned by different forms of infrastructure, be that physical, social, or digital. Physical infrastructure, I haven't talked about much, but includes a whole range of things, from the parks that we all know have been so vital to our well-being under lockdown, to the public transport, which over a quarter of people aged 50 to 80 didn't use in 2018-19, to the libraries, which have fallen in number by at least 500 in the last decade. To connect to our communities, we need places to do it, and we need opportunities to participate. And to improve our state of ageing, we need to invest in the things which facilitate these relationships. Thank you.
Thanks very much, Emily, and really interesting as well to get that perspective on some of the positives around what's going on in communities. And I'm sure that Councillor Charwood will want to be talking a little bit more about some of the great response that we've seen in Leeds, particularly from the neighbourhood networks. But first, I'd like to invite a response from Jack Jones from the TUC, particularly around some of the findings there we've heard around work. So, Jack, over to you.
Hi, thanks for that, Anna, and thanks for that outline of the report, Emily. it's a really interesting report, and there's lots of useful data in there, and some good practical policy suggestions as well. So I think we face quite a difficult kind of balancing act in talking about older workers. I think we need to recognise that people are choosing to work longer, and that increasingly people are having to work longer. And I think the report clearly identifies that. And we need to make sure that those people who are choosing or are needing to work longer are supported in work. But not everybody leaving the labour market before the state pension age is able to, or indeed wants to keep working into the late 60s. So I think we also need to make sure that we talk about having a functioning social security system that's going to support those people that can't work, and also a functioning occupational pension system, which will hopefully give people the chance to retire in their early 60s if they choose to. So we need to have mechanisms in place in work to identify where people will need to retrain, and also to give them access to that retraining. And I think one of the things that we've seen has been increasingly taken up is this idea of a midlife MOT to identify those kind of needs. Because we do need to identify those needs relatively early. It's no use kind of waiting until people are 60 and then talking about retraining. And also we need to fund that retraining. We can't push the burden for that onto individuals. We also need to make sure that we've got and we can enforce the anti-discrimination laws that we have. And also to make sure that older workers, in fact, all workers, have better day one access to flexible working. And that would be particularly helpful for older women. We see at the moment there are, I think, about 125,000 women aged over 60 who are out of work because of caring responsibilities. So I think something to help those people stay in work would be particularly useful. I've got a point in my notes that just says more unions, because I think that is our answer to quite a lot of problems. But I think it is clear when you look at workplaces that have union agreements and union recognition in place that it both gives a really good mechanism for enforcing individual rights, and also for making sure that you've got these structures in place to adapt workplaces to an aging workforce, and also to give that kind of feedback mechanism so that we can kind of address any or thrash out any changes that are needed as we go through this kind of demographic change. So that's kind of a brief outline of some of the workplace kind of issues. But I think we also need to look at making sure that we've got a more generous safety net. And I think the COVID pandemic has highlighted the inadequacy of quite a lot of our social security system. And people have become more aware of the fact that basically everything apart from the state pension, which is far from generous itself, but everything apart from that state pension has been cut to the bone. They're looking at sick pay, job seekers allowance, or universal credit. So what we've got now is a kind of a huge cliff edge between working age benefits and pension benefits. And that's, I think, the gap between pension credit and job seekers allowance over the last couple of decades has gone from about 30% to 130%. And this is particularly relevant for older workers because we've got more than 500,000 people between age 60 and state pension age who are out of work because of sickness and disability. And I think we've already discussed earlier on that that's not evenly distributed. Lower earners are more likely to get sick and then less likely to recover. And we're already in a situation where in poorer areas, there's a huge gap between healthy life expectancy and the state pension age. And we're only going to see that gap growing, and also the gap between richer and poorer areas is going to continue growing. So we need to look at that impact of an increasing state pension age and this kind of gap between working age and pension benefits, because at the moment that's just kind of interacting to lead to increasing poverty rates among over 60s. So kind of what we need is a combination of measures, including things like a midlife MOT to identify needs of older workers, properly funded training opportunities, stronger rights to flexible working, better enforcement of existing discrimination law, and also a fit-for-purpose social security system to support those who can't work, and a rethink of this idea that we're going to have a continually rising state pension age. I just want to end quickly with kind of maybe a slightly naive kind of plea to try and reclaim the idea of a decent retirement as well, because I think it's easy when we talk about kind of the relationship between retirement and state pension age and health to kind of fall into the trap of expecting people to just to work until they drop, and to kind of to focus on these people that can't that are unable to continue working because of ill health. And I think we're losing the idea that actually a decent retirement, maybe people should be able to expect that as a right. And we should look at trying to shape a labour market that gives people the chance to actually have a retirement that they can enjoy. And I think then we quickly get into the kind of much bigger economic questions of how do you deliver productivity growth? How do you make sure that the benefits of that growth are shared more evenly? But I think it's important not to get sucked into this idea that, that the only kind of defining feature of when people should retire is when they are too ill to work.
Thanks very much for those thoughts, Jack. Really great. And I think you're right. I mean, one of the measures traditionally has been looking at the, trends in pensioner poverty, and we have those in our report. But I think it sometimes is misleading, and we forget that actually there's a whole lot of other people who are only just struggling to get by sort of above that poverty line. And, I think there is a question about what is a decent retirement, but you also rightly highlight the sort of significant gap between those approaching state pension age, if they have and are unable to work, the sort of difference between those working age benefits and what they can expect when they reach state pension age. We'll come back to this in the discussion, but I'll prompt you now. There is a question in the chat about, well, should we be is this the moment for universal basic income? So I'll put you on notice for that. But I'd like to go to our final panellist, Councillor Rebecca Charwood from Leeds City Council, who are a partner with Ageing Better and Leeds Older People's Forum, and delighted to have you with us. So over to you, Councillor Charwood.
Thank you very much for having me today and for inviting me to speak. It's a really wonderful thing to be able to speak at this important event, because I'm the Cabinet Member in Leeds for Adult Social Care and Public Health, and I also chair the Health and Wellbeing Board. But we have a strategic partnership with the Centre for Ageing Better, and it really is an extremely strong partnership which allows us to deliver so much more for the people of our cities. So I'm really pleased to be able to come and give a view from one of your partner cities as to what we're doing and how we're working together in response to your really welcome report. And I really like the fact that you've got to focus on the economic inequality of 50 plus, especially people who following the economic challenges following COVID in the workplace. And I also really welcome the inequality focus of the report more generally, and the call for us all to work on the agenda. Leeds has an ambition to be the best city to grow old in, and through our health and wellbeing strategy, we're working to ensure people who are poorest improve their health the fastest, and that's a strapline that's right at the heart of our whole health and care strategy. The key to this in this difficult economic times, and for the last 10 years as well, has been to work in partnership and deliver through partnership. Organisations and communities working together and understanding what's important to people and helping them to live the lives they wish to live, being a facilitator of that, as a bit like what Janelle was saying about less service land and more empowerment. We've been working really hard during the pandemic to reduce inequalities, which have been widened by this pandemic, and the wider impact that it's had on older people, such as social isolation, and the fear and shielding and the isolation that's come from the health impacts as well. We've done proactive targeting and engagement with people in their neighbourhoods through commission services, the services we fund and pay for and plan. Our local third sector, our faith groups and our culturally diverse community groups have really helped us to understand needs and barriers in our communities to make sure important messages are reaching everyone. And I would really echo what the report says about the surge in community activity during lockdown. We've seen this in Leeds with over 8,000 volunteers coming forward to a scheme we ran with Voluntary Action Leeds to help people who perhaps couldn't leave their home in the first wave to get things that they needed and to battle isolation. And we worked really quickly together with our staff and partners and Leeds Older People's Forum, which we fund in the city as well, to set up an Are You OK service, calling people, responding to requests for welfare and linking volunteers to people that needed food, prescriptions and social contact. The long-term investment we've made into our 37 neighbourhood networks over the last 30 years meant that we have got a network of organisations that are born from communities and are closely knitted into the fabric of those communities and that cover the entire city. And they were able to respond quickly and flexibly during the pandemic for our older citizens. They adapted to the new needs and circumstances of their members and the wider community and provided a wide range of practical, social and emotional support. And we really welcomed the present evaluation that the Centre have commissioned on our neighbourhood network services, which showed how important the infrastructure is in terms of our community participation. The reliance upon digital solutions hasn't been easy for many people. Before the pandemic, we'd invested in delivering digital champion training with staff and volunteers to support people to gain confidence, skills and motivation to access the online world. And over 500 people have been trained in the last year. In light of the pandemic as well, 100% Digital Leads, which is a service we run to help people get online, has supported over 20 organisations working with older people to adapt their services to provide virtual sessions and digital support for their service users. I mean, my 95-year-old grandmother can't go online. She doesn't have the skills or the ability to learn those skills. And I think we need to recognise there are people who we cannot reach in that way, and that will exist, unfortunately. But sadly, there are also differences in life expectancy across our city, between up to 10 years difference, depending on where you live, in terms of more affluent areas to our more deprived areas. So it's so important for us to support the continuation of healthy behaviours as much as possible, and in our more deprived areas as well, to improve access to opportunities for people to increase the amount of physical activity they take, for example. So we've established what we call Get Set Leads, which is a partnership of people from all over the city who want to play a part in making Leeds more active, either through organised activities or walking more often, and trying to build activity into everyday life in a very asset-based community development sort of approach, helping communities do it for themselves. And during lockdown, we were really conscious that a lot of residents were shielding or self-isolating, and we were concerned they may lose their strength or balance, and that health could be affected even more so that way. So we've distributed a printed booklet on keeping well at home, which gave tips about building movement and activity into a daily routine, and many other projects that go on around strength and balance. The fact that the number of people aged 50 and over claiming unemployment-related benefits has doubled between March and September this year, as you highlight in the report, is a real concern. Leeds has set out its economic recovery framework and established an employment and skills task group, bringing together public and private sector partners, including employers from key sectors, to tackle this. Many of us are very fortunate with the homes we live in, but the report points out many people have had to go through lockdown in homes that are not an acceptable standard. We have a partnership group, Me and My Home, which focuses on this issue, but we really need to call on national government to support us in finding a solution. The State of Ageing reports are really important, and they're as strategic partners to us and the Centre for Ageing Better. It's been a real pleasure to be invited today. So when the report came out, we were really impressed and thought it would be great to do a similar report using the data and evidence we have in Leeds to understand what it's like to age in our city. So we're starting on that now, and I'm sure it will influence our future age-friendly work and support our ambition to become the best city to grow old in. Thank you very much.
Thanks so much, Councillor Charwood, and we're really excited about working with you to produce the State of Ageing in Leeds for next year. So taking our national report and looking at what we can learn about using local data to assess the state of ageing. And it's been really great to hear from you about what it actually involves to be a place, become a city that's a great place to grow old. And it does mean addressing all aspects, housing, employment, health and communities, as you've described. So really great to get that overview. And also, I think one of our questions was around the role of the voluntary sector, and you've made very clear how important that has been in Leeds during this period and the critical role of Leeds neighbourhood networks. There was one question which was, and it's actually the highest rated with 16 votes. Do you think that every area should have an overarching age-friendly partnership, as you have in Leeds, to ensure that there is effective recognition of the impact of our ageing population and to make effective and shared change possible? So thoughts from you, Councillor Charwood, on that?
Yeah, it's a really great question. That yes, it wouldn't surprise you to me to say that yes, but I'll say why. Because we have in Leeds, we have child-friendly Leeds ambition, but we also have an age-friendly Leeds ambition, and they're two very important key sort of pillars or central points in all the work that we do. And because you have it as a stated ambition, everybody can pull together around those ambitions, and you can have it in your sort of best council plans and your strategic approaches. But what it allows us to do is, with this partnership with yourselves and across the city, is harness the energy and passion that people have for other people. We have a compassionate city approach, which people love that. You know, people want to be a compassionate city. They want to do the right thing for people, and it helps to break down barriers of service delivery. So it stops people saying, well, my service stops here and your service starts there. It's more of a question of how can we create this outcome together? What can each of us do to build this outcome of an age-friendly city? So it really provides a framework for us all to work towards. And again, delivering through partnership is the only way to do anything really at the moment for the last few years. So I would urge all areas to do that. Yes.
Great, thank you. And certainly we support the UK network of age-friendly communities, and it's been great to see that growing over the last couple of years. And we would urge anybody who's involved in their local area to find out more about becoming an age-friendly community through our website. I'd like to come back to you, Jack, just on a couple of the questions. So we've talked about what is the potential of a universal basic income to try and smooth out some of that differential and to help people perhaps transition from work to state pension, even if they are unable to work. So just any thoughts on UBI?
Yeah, clearly, I mean, it's an attractive idea, and if it was high enough, it would eliminate that kind of cliff edge. But I think so. The benefits are quite clear, but obviously there are a lot of questions about how it would work in practice. And I think if we were to go down that route, it would be a very long-term project. And I think you've got to look at the context we're in, where you have a government that's done nothing to increase statutory sick pay beyond £95 when we're in a pandemic and asking people to self-isolate, when they've conspicuously to £20 a week on universal credit after April. And within that context, it feels like fixing that social security net, social security safety net, is a big kind of ask in itself, but an achievable one. And I think it might be better to focus on that kind of achievable aim than looking at the slightly more utopian and longer term projects. But I mean, obviously UBI, it's certainly something which deserves attention, deserves pilots, and deserves looking at, but I don't know if it would solve the kind of the more immediate problems we've got at the moment.
So I'm very conscious that we're running out of time, and I feel like there's so much more rich issues that we could be pursuing and many more questions. Thanks to everybody who's been posting on Slido. If we haven't got to your question during the discussion, there will be a chance. We'll be trying to answer some of those questions on Twitter after the event. So do hop on to hashtag State of Aging 2020, and we'll pick up some of those questions there. We thought we might just finish with a final poll from you, just to get your views. So if you are on Slido, we're just going to ask you, how has your outlook on later life changed as a result of the pandemic? Are you more positive about the prospects for later life, more negative, or are your views unchanged? So this is really specifically about the impact of the pandemic. So if you've got that open, do please vote now, and we'll just leave that open for a moment. But while we're getting those votes in, and perhaps just go to our panelists for a final word. And I'd just like to ask each of you, and welcome for Emily and Catherine to come in on this too, just to sort of say, what one sort of top action do you think needs to be taken? And I don't mean just by national government, it could be by local government or others, to help address some of the issues that we highlight in State of Aging 2020 in terms of getting us on a better trajectory towards more people having a good later life. So just to highlight one thing. So I'll come to you first, Jack.
Well, I tempted to go for my more unions point, but it might be probably the best thing would be to start valuing experience more in the workplace. I think when we're looking at kind of which workers to invest in, I think there's an understandable desire to focus on younger workers at the moment for a number of reasons, but I think often that undervalues the role of the value of experience.
So valuing a diverse workforce. Thank you, Emily.
Yeah, I can only see the immediate, I'm afraid. So let's make sure that Restart actually works for older people. Let's not have a repeat of the work programme, which absolutely did not work for the over 50s. Let's work together to make sure that we learn the lessons of the past to make sure that this provides employment support which actually works for people who are 50 as well as it works for someone who's 30.
Thank you. Councillor Charwood.
Well, I'm going to go on more funding for community services, but when I say services, I mean for approaches which build community connections and build the fabric of our community, so people don't feel alone and have somewhere to go, and there's a support network out there for people. Thank you. And finally, Catherine.
I think I'll choose that 2020 has been a year where to be old has been to be homogenized as a group of frail and vulnerable people. And I think we need to, in 2021, move beyond that ageist and sort of dangerously restricting view of aging and be more optimistic about what we can achieve for so many more people as they get into later life.
Thank you all very much. And just in terms of finishing with the poll results, it seems that about half of you do think that as a result of the pandemic that your outlook on later life has become more negative. Many of you, a third, unchanged, and 1 in 5 more positive. So let's hope that as we go into 2021, we might see some of the opportunities, particularly some of the data that we heard about stronger community. And let's hope that as we come out of recession, there will be opportunities for workers of all ages to get back into work. So thanks everyone for joining today. Thanks in particular to the panellists, to Janelle De Grucci, Councillor Charwood and Jack Jones, and to the team at Ageing Better who produced all of the fantastic data that you can explore on our website. So thanks for joining today and wishing you a good day. Thanks very much.